now.
Good evening, everyone. Wish TV proud to be the local official broadcast partner of the 2022 College Football Playoff Indianapolis Host Committee. And we start tonight at 5 o'clock with a contingency plan for the national championship game that will be played right here in Indianapolis. So here's a look at the scenarios. All right, we'll put them up here. If a team in the semifinals can't play because of COVID-19, you see it here, that team will forfeit and the other will move on. If both teams can't play, the team winning the other semifinal would be declared national champion. If 3 of the 4 teams can't play, the one that can will be declared national champion as well. If a team in the national championship can't play, the game will be rescheduled, but no later than Friday, January 14th. Now, if a team still can't play, they will forfeit and the other team will be crowned national champion. Kind of confusing, I know. If neither team can play due to the virus, there will be no national champion this year.
The FDA has approved Pfizer's COVID-19 pill, and it's the first U.S. authorized at-home treatment for the virus. The prescription pill is also the first medication in the country that does not require injection or IV. Pfizer says initial supplies of the pill will be extremely limited, with enough only to treat tens of thousands of people. The pill is approved for people 12 and older. Patients will need a positive COVID-19 test in order to get a prescription.
All right, let's welcome in Wish TV medical expert and former Surgeon General, Dr. Jerome Adams now. Doc, always good to see you. Happy holidays. We just talked about the Pfizer. Very good. We just talked about the Pfizer at-home pill. How significant is this, and what does this mean for the current surge in patients?
Well, it's good news that we're now getting more treatments available for people, particularly as we're seeing this surge coming on us. But I want to put it in practical terms for you. The fact is that you can't get the pill if you can't get a test. And right now we can't get a test, number one. Number two, as you heard Alexis lay out, there's only going to be about 10,000 doses for very, very high-risk people. And so the truth is we're probably going to be beyond this Omicron surge by the time we actually get enough tests and enough pills for this to have a meaningful difference for us. Still good news that we have something.
Yeah, that being said, though, your reaction to the president's announcement yesterday that more COVID tests are coming.
Well, again, good news that the administration is finally looking at this as a priority. I and other people across the nation have been saying this for months. They announced 500 million tests, 500 million tests that would be made available, but they won't be made available until January, number one. Number two, 500 million sounds like a lot. That's less than 2 tests per American citizen. And you're supposed to take a test one day and a test next day for the rapid test to actually give you really reliable results. So it's not as much as we need, but it's a step in the right direction.
So in your opinion, is lack of tests so far a failure by government leaders?
Well, this one I'll be quick on, Phil. Absolutely. It is a failure. Yeah, I'm talking to people literally on an hour-by-hour basis in my family, in my neighborhood, at work, who are telling me, hey, I've got symptoms. What do I do, doc? And they can't find a test.
What's the advice that you give to someone right now who thinks maybe they have COVID, not feeling well, wants a test before going to a family function with the holidays coming up this weekend? What do you tell them?
Well, go to the State Department of Health website, look up the nearest site to you. And in some cases, I know people have had to drive 40 minutes away to get a test that day. But there are still some testing sites you can go to, number one. Number two, if you can't get a test, you need to act as if you've had COVID in the meantime. That means isolate yourself. That means wear a mask if you're at all concerned about an exposure when you're going around other people. Act as if you have COVID, particularly if you're going around other people who are at risk.
I don't know if you heard the very top of the show, but college football playoffs here in Indianapolis could be delayed or even canceled based on COVID cases among athletes. What about fans, in your opinion? Do you have concerns about those major events, including NFL and NBA games and the spread of Omicron?
Well, I absolutely do now when we look at how infectious Omicron is. 1% 3 weeks ago, 13% 2 weeks ago, 73% a week ago, and now over 90% of cases here in the Midwest, Omicron. The fact is we all have a date with Omicron. It's just a matter of whether or not you're going to be protected. So get your vaccine, get your booster, which gives you additional protection against Omicron. But be aware that if you go into a crowd, particularly right now in this surge, it's likely you're going to be exposed. So you don't want to go in there if you're at risk. You want to make a smart decision. You don't want to go there if you're bringing it back home to someone who's at risk. And you don't want to go in that kind of environment if you're not maximally protected with a vaccine and a booster.
Hospitalizations, as you very well know, hovering right around 3,000 here in Indiana. The U.S. Navy now sending personnel to help IU Methodist Hospital. Are we at the worst of the surge, or is there unfortunately more to come?
Well, I wanted to end on good news, but unfortunately I can't. I've been in the hospital twice this week working. The hospitals are preparing for this surge. They're pulling out their emergency response systems. And as you heard, the Navy's coming, FEMA's been called. We're going to continue to see this Delta surge that hit us hard play out over another 1 to 3 weeks, because these people are still in the hospital. They're still holding up the hospital. And if we have a big surge of Delta patients, even though the virus may be a slight bit milder, it's 4 to 5 times more infectious. That could be the straw that breaks the camel's back. So please get vaccinated, be safe, make smart decisions this holiday season.
Dr. Adams, always good to see you. Happy holidays, sir.
Thank you. And we can get through it safely if we just use the tools we have. So I don't want to be dour. I want you all to understand we can get through this. We need to pull together and have a happy holiday season.
Yeah, no doubt. All right, doctor, good to see you. Thanks.
New at 5 o'clock, businesses in Indiana are set to make changes while the city continues to see a significant rise in COVID hospitalizations.
But as News 8's Camila Fernandez reports, that can turn into massive challenges.
Basically, right now, we just don't know what's going to happen. We're all in the dark.
Businesses are monitoring new COVID restrictions in neighboring states while the country watches case numbers soar.
We do what we do to keep folks safe, and we just address these things as they come to us.
In Chicago, bars, restaurants, and gyms are bracing for a proof of vaccination requirement come January 3rd. The owner of Square Cat Vinyl and Snake Root Botanicals, Mike Angel, says to police customers puts a lot of pressure on businesses. While that mandate hasn't been made here, Angel says keeping his staff and customers safe is at the top of his priority list.
Most of the music venues in the city have already done that for live concerts, and we did that, and we haven't really talked about it for any other like day-to-day operations. I guess we'll address that if we get to that point as a city. Hopefully we don't get to that point.
Some businesses like Greek Islands Restaurant tell me there's been a lack of workers and that a vaccination card mandate could make business a lot harder.
Well, for us, I mean, to add that to restaurants, it's kind of not fair, you know, as far as the fact that we're going to have to check vaccine cards when we're already having trouble, you know, taking care of our guests.
Angela says with large events happening in the city, it would be unfair to add yet another obstacle on businesses.
If we're having all these public events, and we're not social distancing, and then we expect restaurants to mandate and check vaccine cards, where is the fairness in that?
Camila Fernandez, Wish TV, wishtv.com, and follow us on Facebook.
Camila, thank you. The country's largest drugstore chains rationing COVID test kits. WALGREENS will only sell you 4 kits at a time. The limit at CVS is 6. The kits are out of stock in some stores and online. The pharmacy chains confirmed demand started surging around Thanksgiving and is increasing with Omicron's arrival. Americans may soon be able to get free tests in the mail following the Biden administration's purchase of a half billion of home tests.
Urgent care clinics say COVID patients are filling their waiting rooms. News 8's Garrett Berquist checked in with one local clinic to see how that's affecting their ability to care for you.
Some urgent care clinics here in Indianapolis say as many as a quarter of their patients are people coming in just asking for COVID tests. The clinics say conditions at the hospitals where COVID patients are filling up beds are rippling through the entire healthcare system.
Taquita Taylor's running a lot of COVID tests these days.
A lot of the visits that we've been seeing have been due to respiratory illnesses. So dealing with COVID-19, of course, flu, and also RSV.
Taylor owns a pediatric urgent care clinic on the northeast side. She still has room for patients, but she can tell the hospitals are getting crowded.
I would say we're up about 50% from 2 weeks ago. And basically, you know, with the hospitals being full, a lot of people don't want to go to these ERs.
Urgent care clinics all over Indianapolis report the same thing. Some told us they too are near capacity.
As I'm seeing all this unfold, you know, it gets scary. It's very scary, of course.
Taylor says most of the time, the people who are turned away from the hospitals have conditions she can handle anyway. She says it's a good idea to call first, especially since testing procedures can vary. Taylor says the best way to reduce the chances you'll need medical attention is to get the COVID vaccine.
We highly encourage the vaccine. You know, yes, you can still get COVID with the vaccine, but it helps decrease the hospital, being hospitalized.
Urgent care clinics tell me you can help them out by scheduling appointments via telehealth and asking your primary care physician for things such as COVID tests. That will help them save room for the people who really need it. That said, if you have a true life-threatening medical emergency, they say you still need to go to the hospital. In Indianapolis, Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.